hope I won't fall off the stool. They have given me a stool so that my height is increased. Like Shahzad sir, and then I can talk to you. So, I'll be speaking to you on functions of shoulder. Before I begin, let me thank PMR Kerala Chapter, Dr. Selvan and Santosh for giving me an opportunity. And I'm also honored to be presenting in front of my friend Sonu, Dr. Sindhu, and my mentor, Dr. Surendranil. Thank you, sir. So, I'll be speaking to you. The functions of the shoulder is so vast, like Shahzad sir has said, and Dr. Shahzad has made it easier for me to speak on the functions of the shoulder. So, I'll be speaking on functions of the shoulder, some scapulothoracic movement issues, shoulder considerations, different assessment tools for shoulder function, and I shall conclude. So human shoulder is actually a miracle. You can see that child doing a cartwheel. The ability to carry significant weight without sacrificing mobility is in itself an interesting phenomenon. So probably from the Jurassic era, when shoulders were more stiffer, to mammals when they started absorbing the whole body weight on their shoulder, from their hands onto the shoulder, they could start moving much more faster. To when we started losing our tail, the shoulder started doing a full circumduction. So the functions of the human shoulder relates to the many needs of our societal roles. So we are sometimes a father, sometimes a friend, sometimes a student, sometimes a teacher. So these functions of the human shoulder relates to the many needs of our societal roles. From placing food in our mouth, to dancing, to lifting, to climbing coconut trees, to wrestling, to carrying water so that you can drink at home, to compete in sports and run, it makes you faster if your shoulder is good, to putting on a t-shirt, to swimming, to writing on a blackboard as a teacher, to cooking, to walking on a tight rope, to throwing as in cricket. And these intricate gross and fine functions are dependent on a mobile yet strong base, the shoulders. No wonder they say to shoulder all responsibility, whether it is your near one or your dear one. So the responsibility of the shoulder is primarily to position hand in space, and secondly, in athletic activity, to act as a funnel through which the forces from the larger muscles of the leg and trunk are passed on to the arm, forearm and hand, and vice versa, according to Brian S. Cohen. So I couldn't get a particular textbook which says about functions of the shoulder in particular and categorized accordingly. So I put it all together, some important aspects. So the force transmission from trunk to arm in hand, as in throwing. 1 minute. So as in throwing, the force goes from the body to the hand and it transmits the force. Then force transmission from hand to arm and trunk back, as in catching. So your shoulder does that. The lifting the body from the ground, as in gymnastics or crutch walking, and reaching as while playing badminton. So I initially thought that only badminton players needed to reach, but now I understand that even we all need to reach it sometimes. So this actually gives a good position, allows your hand to go anywhere around your body to protect you and to help you. So steadying the body for balance as while standing on a moving bus, taking weight on the shoulder as in using a shoulder bag. That is again the shoulder bag. You know, you're all carrying it. and absorbing shock forces put on the upper limb. That is when you are falling or you have to close a tight door or something, and many more functions. So these functions are possible because the glenoid follows the hand. That is the most important. The glenoid follows the hand. And the components responsible for the glenoid to follow the hand are the interdependent linkages. I don't need to tell you all these things. The scapulothoracic joint, which is a muscle bone, which will give you lots of movement, and it's soft. Then the muscles, not just the glenohumeral muscle that your rotator cuffs and the deltoid, but also the scapulothoracic muscles. A mobile glenohumeral joint. The force couples. There are many force couples in your body. Some we have found, some we have not yet found. So the vector of the trapezius and serratus causing the scapular rotation. So they are in team with each other. Then in a closed kinetic chain, the latissimus dorsi depresses so that you can do both a crucifixion stand in gymnastics as well as walk with a crutch. And the force transmission from the trunk to body, the medial border of the scapula should stay as contact with the thorax as possible so that the throw is far more stronger. And hundreds of force vectors that occur on your shoulders. And this is just an example of the anterior shear, that is 400 Newton when you are throwing in athletic sports. And it's not surprising that your ligaments will get torn if a small position is changed. And glenohumeral and proprioception, that is glenohumeral instability affects proprioception. And shoulder is represented in the superior part of the precentral gyrus, that is your homunculus. So homunculus finally decides, even if some muscles are injured, the homunculus decides how you can compensate for it. So the scapulothoracic humeral rhythm is held by your homunculus and all the other muscles. So if you are having proprioceptive issues, then you can have a scapulothoracic dyskinesia, which affects function. And functions of the shoulder are many. It is difficult to quantify function of the shoulder because there are hundreds of functions that are there. But however, fair attempts have been done to address it. And the functional shoulder assessment methods are necessary to identify structural and biomechanical changes and link them to the patient's functional limitations and disabilities. So there are several scales. They are constant Murley score, SPADI, dash, quick dash, work index, Western Ontario. So constant evaluates the shoulder function after shoulder injuries. This is the score. You can all get it from the net. SPADI, that is a shoulder pain and disability index, evaluates the shoulder function in OPSNE. You can do it fast and it has got good reliability. SPADI score. Oxford shoulder score evaluates daily activities and it's also reliable. Dash and quick dash has only 11 items and that is an easy score, and we have done researches on it and using it. This is a quick dash score. Work index is a Western Ontario rotator cuff score and function basically for rotator cuff injuries. And shoulder function, a simple test, that is a shoulder function mobility test, that is you just hold it like this and then measure the distance between your fingers, but you should not use it after a shoulder surgery or immediately after an injury. So the less the distance, the better your shoulder mobility. SPADI has good reliability and validity. And the other shoulder scores are shoulder outcomes, Arat, lift-offs test and many more scores, Wolf function, etc. This study is actually a good systematic review of existing validated outcomes scores, how to assess shoulder functionality. Maybe you can read it up because there's a lot of data in it. So the objective was to compile validated functional shoulder assessment tools and methodological quality of their validates. And the highest quality was obtained for SPADI. So SPADI is good for your shoulder pains, and they have said what it is used for, each of the scores. So SPADI for periarthritis, adhesive capsulitis, constant Murli for arthroplasties. The review was there was a high methodological quality was obtained for UCLA shoulder scale and SPADI, adhesive capsulitis mainly SPADI, and reaching above the head was used in most of the tools. So the other functional considerations is, can I have 1 minute? The scapular plane position is important, that is 30 degrees of in the horizontal plane forwards and 30 degree of elevation. So that's the, and the balance position, that you lie supine and then keep it straight. So this is the other thing is arthrodesis you have to do at 15 to 30 degree of flexion, 20 to 30 degree of abduction and 30 to 40 degree internal rotation. This is the best functional position. So when you do rehabilitation, you have to also address proprioceptive neuromuscular facilitation and synchronization and rehabilitation of all the components of the kinetic chain is required before the successful return to competitive level activity. So regardless of the injury, the goal is to restore function and return to activity. So when you design, you should take the patient's anticipated level and type of activity and patient's participation restriction due to the shoulder dysfunction. So strengthening the scapula stabilizers is an important part of the protocol. So in short, as the most mobile joint in the human body, the shoulder is structurally insecure. Assessment tools like SPADI help link impairments to functional disability, and stabilizing the scapula goes a long way in improving shoulder function. So this machine made up of linkages helps position the hand in space for our routine societal needs. Thank you, but improve your shoulder function also. Thanks.